penis is like two cylindrical dish sponges right next to each other. And those dish sponges are surrounded by their original wrapping plastic that they come in from the grocery store. When blood flows into that sponge, the sponge expands, it tightens up that saran wrap layer, and that's what an erection is. And then, of course, the process reverses itself after intercourse. The injury that can occur, the trauma that can occur with Peyronies disease is to that plastic layer of tissue. So imagining, again, this thick, dense layer around the spongy tissue of the penis that then becomes scarred because of different reasons. The most common of which, believe it or not, is just microscopic trauma. Things that we're not even aware of, bends or kind of a little bit of a discomfort here and there during intercourse that can result in, over time, the scarring. Now, when that happens, a big part of therapy is understanding two things. One, how much it's changing. So what it looks like, and if it's actively a problem, or is this something that seems to have stabilized? Two, is how much of an impact it has on intercourse. Some men want it corrected from an aesthetic standpoint. It doesn't look right. But oftentimes the thing I'm focusing on is, well, let me understand how this impacts you during the act of sexual activity, because that then becomes another functional problem we have to deal with. So understanding that and understanding the degree of curvature then helps me pick for patients what their options would be best for in terms of repair. For some men, we see in about 10% of them that it just resolves on its own over time. The majority of people, it will stabilize, and it may not necessarily be very disruptive or bothersome to them, and we may do nothing. However, there are men who have more progressive issues. There's options like penile traction for straightening of the penis. A little bit cumbersome, difficult to do, but it's possible. More commonly, we're doing injections called Xiaflex, a medication that helps kind of break up the plaque or the scar tissue that's there and allow us then to use the kind of what we call traction therapy to make the penis a bit straighter. Surgical options to repair the curvature. The most commonly performed is something called application surgery, where we essentially work on the outside curve and shrink and pull together the tissue to help you get straight. And then, of course, there's men who have more progressive issues, and we're doing penile implants to help correct both the curvature as well as the erectile function. And in some particular cases, there are men who have intact erections, but very severe curvature. I mean, I've seen men who've had curvatures more than 90 degrees facing them that just require a penile implant to correct the problem altogether. So there are definitely options that are available, some of which are very minimally invasive and easy to pursue.